Danielle Smith came to office promising to fix healthcare quickly. Instead, her government has presided over revolving door leadership, expensive privatization gambles that often had to be reversed, widening questions about procurement ethics, and continuing pressure on emergency, surgical, and rural services. Is the UCP government simply incompetent to manage Alberta's healthcare system? To answer that question, I spoke to Lorian Hardcastle, a professor of law at the University of Calgary. Welcome to the interview, Lorian.
Thank you for having me.
Well, it's great to have you back. I interviewed you 3 or 4 years ago during the pandemic, and we talked about how the government of Alberta was handling the pandemic. And you said something that really stuck with me. You said that the government of Jason Kenney, the Smith's predecessor as the United Conservative Party premier, was simply incompetent. Like it just couldn't run the machinery of government and made all sorts of mistakes and errors and goofy stuff that any management, I mean, you wouldn't run, certainly wouldn't run a private corporation like that, which is what you hear all the time from the UCP. And I'm wondering if the Danielle Smith's UCP government, given how it's handled healthcare, isn't continuing that tradition of incompetence.
So I do think that if we look, for example, at the reorganization of AHS, if we look at the handling of these scandals around private surgical contracting, we see both problems with ideology, but also with competence. There are choices that have been made that, even putting ideology aside, it's just not fathomable where those decisions were coming from. So to give you an example, this breaking up of the healthcare system into four silos. There's not evidence for that. There aren't other jurisdictions doing that. They weren't able to point to evidence for that. It is just a bad choice. Whereas the scapegoating of AHS for its handling of the pandemic and firing of the CEO, that's ideology. But if your ideology is to scapegoat AHS and sort of to criticize their approach to COVID, that's one thing. But your response to that doesn't then need to be one that isn't evidence-based, that isn't going to fix the problems in the healthcare system.
And I can see viewers watching this and going, "Oh, come on, it can't be that bad." I mean, how incompetent can these people be? There's a couple of lawyers in there. There's some professionals. I'm surely, but I'll give you an example. I had, and unfortunately, this was a on background, so I can't provide the professional's name, but they were in the Department of Energy, and the government about 2 3 years ago brought out its emissions reduction responsible energy development plan. And this professional told me, she said, "Look, I was working in the department at that time, and I can assure you that not one energy professional had any input into that plan. It was completely done by political staff. And when you actually read the plan, you go, oh, that makes perfect sense. Now I can see that it's just a catalog of various things that they've been doing or want to do. It's not a plan at all. And if that is how they run the energy department, then I can only imagine that the same principles are at play in the healthcare department."
Yeah, so I think that if that is happening in the energy sector, we can see inklings of the same thing happening in the health sector. So, for example, you'll hear the government make an announcement, and then the people who are the leading experts of that particular issue will say, I wasn't consulted. This doesn't make sense with the evidence. The people they did consult are not experts in this area, but rather are people who are likely to have confirmed their ideology. And so there is really a turning away from expertise, a turning away from evidence in order to further these ideological goals.
Yeah, the volume of scandals and problems that have arisen over the I mean 2.5 years, and governance upheaval, chronic instability. Boards have been fired twice. 2AH Alberta Health Services Board, privatization experiments that backfired and had to be. I've got a list of them here. Corruption and procurement probe, where the Auditor General is involved. Emergency room and pediatric crises. The ambulance shortages and red alerts. Rural service erosion. It just goes on and on. I mean, the Tylenol scandal. So what have we ever seen a government in such a short time have this many scandals and criticisms of their performance?
I can't think of one. If I had to try and think of a competitor, I suppose it would be the Ralph Klein's government's management of the healthcare system, which had some of the same problems. Concerns around privatization, alienation of healthcare professionals. So some of the same kinds of issues. That said, they also were doing things that at the same time were in line with some of the trends in the country and the health policy evidence around integration. And so they had problems for sure, and certainly almost permanently damaged the healthcare system. But there also were things you could point to that maybe they were doing well. With this government, I tend to think it's worse because I find difficulty to find examples within health of things that are going well.
Yeah, and it seems like, and I do want to point the finger at Premier Danielle Smith here because there have been all sorts of comparisons between her time at the Calgary Board of Education 20-ish years ago, and where the board had to be sacked, and she was described as one of the ringleaders of the confusion and chaos there, and then she goes and she's leader of the Wild Rose Party after the 2012 election. That she crosses the floor and joins the Conservatives and throws the part, basically destroys the Wild Rose Party. And now here she is. And you were mentioning you've been interviewed by Danielle Smith on her radio show. I've been interviewed, and it is chaos. She gets these really extreme people on there. She did, and then they're yelling and they're conspiracy theorists. I mean, there's a trend here. And she's basically, it appears to me from the outside, she's running the government just like she runs her talk show, ran her talk show, and these other things she was involved in.
Well, and the interesting thing about when I went on her show was we talked about these private surgical contracts, and I said, your listeners might be inclined to think that private is better, the private system is more efficient, these sorts of arguments that you tend to see out there. But even your listeners who are in favor of it need to be concerned, are we getting value for money? Are there financial conflicts of interest that we're setting up by having health providers who may be investors in these facilities, but who also are in leadership positions? Are we getting good quality of care? And we talked about these concerns, and she said, there are other jurisdictions that outperform us in with their healthcare systems, but who have privatization. And I said, yeah, but they regulate these things, they monitor these things. Like, they don't deny that these are issues that you will tend to see crop up. Yet we didn't see this government do this as they leaned into these private surgical facilities, and that is a competence issue, right? These issues are well documented around the world, yet they seemed surprised when they learned that we were paying chartered surgical facilities all different amounts to do the same surgery. Well, you knew that was coming, or they seemed surprised by these conflict of interest type allegations. Well, those examples exist around the world when you have people who are investors in facilities and also are treating patients, then these concerns can arise. And so to be surprised by these very obvious problems does seem to be a real competence issue.
Yeah. So, if I understand you correctly, there's been the debate between public delivery and private delivery for a long time. Other jurisdictions have tried it. They've learned over time that you need to have systems in place to monitor private contracting or private delivery. And it's available in the literature, and there are probably plenty of experts in Alberta who could have provided advice for them. And so it sounds like the government comes in with an ideology already in place, that predisposition to think that private is better, and then completely ignores all of the guardrails, all of the checks and balances that are required to actually make that system work once you've made the choice.
Right. So for example, one of the concerns that you'll hear talked about is that if you have a parallel private system, it competes with the public system for health professionals. And then you end up with anesthesiology shortages, say in public hospitals, because they're working in these facilities, well-known problems. And if you look to jurisdictions like Ireland, like the UK, they have had to regulate these issues around when they contract physicians, how much percentage of their time are they spending in public hospitals versus their private clinics. And so there are examples. Personally, I would have invested the money into the public system and think that's the better option over contracting out. But if you are going to contract out, there are healthcare systems around the world doing it. There's literature about it. And so it could have been done in a way that better protected uh, cost, access to care, equity, all of these things.
Now, you're a professor of law, and so governance is one of the things that you know a lot about. And the fact that Smith has fired two Alberta Health Services boards in 2 years is kind of mind-boggling.
Yeah. So we've had a revolving door of boards of including there was an administrator in place. We've had multiple CEOs of AHS, which of course is the largest public sector organization in the province, delivering some of the most important health services in the province. We've also had multiple chief medical officers of health at this point. And so when you have this kind of instability, it is difficult to govern these complex sectors of society when you have this revolving door of leadership. It also creates difficulties with recruitment and retention. And so, having seen what has just happened to the most recent CEO of AHS, if you were someone who was inclined to apply for that type of leadership position, had experience in that type of leadership position, I don't know that you would apply in Alberta as opposed to applying, to be CEO of a hospital in Ontario or wherever else. That just wouldn't be tempting for me. Or if you were an expert in public health who was qualified to be a chief medical officer of health, I don't know that you would apply under this government who has had this revolving door of chief medical officers of health where there are concerns with political interference in public health. I just don't know that you would apply to that position. And so we've put ourselves in this position where I don't know that we're going to be able to recruit people easily to these crucial roles within the healthcare system.
One question I have for you, and maybe this gets back to your legal background, and that is there are crises such as emergency room closures, where you can go for hundreds of hours sometimes without the local emergency room being open, and also ambulance shortages and red alerts. But those seem to be the provision of those services, to my mind, somewhere there's got to be legislation because that sets out, okay, at the federal level, we're going to give you this money. You have to maintain a certain level of care, right? You can't just fritter away this. You have to provide these services, and they're not happening. So, is this government violating either provincial or federal legislation in allowing these things to happen?
Yeah. And so, federally, the Canada Health Act is an interesting piece of legislation because it does give the provinces these transfer payments if their system meets certain criteria. However, those criteria are very vague. So, for example, they have to provide accessible and comprehensive services, but what that means is really left to the provinces. And the federal government has really, over time, pulled back in terms of how many strings it wants to attach to that money. And the reason for that is really because the federal share of healthcare budgets has gone down over time. And so initially, it really was a cost sharing program when Medicare was first created. Over time, the federal government has dialed back their share, and it really was quite low in the 1990s. And then the provinces pushed back and said, if you've left us with this expensive bill, we don't want your strings attached. And so there's the legislation is vague, but there's also this sort of political tango where the federal government can't ask a lot given the share that it's providing. And so instead of attaching strings to the basic healthcare services. Instead, where we maybe tend to see federal strings attached more is in new programs. So, for example, this new expansion of federal drug benefits, that is a new program, and so it's easier for them to attach strings to it than to kind of go back and say, well, with these hospital and physician services you've been providing aren't very good, so we want to attach strings to them. So that's sort of the challenge federally. Provincially, the legislation is also pretty vague in terms of specific quality of care standards. And this isn't unique to Alberta. There's always discussion, and it seems to be one of those healthcare issues that rears its head every few years, that should we have care guarantees around how timely care should be, or these sorts of things. And so it is an issue that comes up over time, but isn't one that's gained a lot of traction in Canada. So there aren't a lot of promises in the legislation in terms of how quickly you can expect to access services, or these sorts of things. And so the law hasn't always been a particularly powerful tool to hold the government to account for its decisions in that health space. You'll occasionally see lawsuits on specific issues, but those tend to be pretty specific kinds of matters. These sort of overall lack of access to timely care has been something challenging to find legal tools to address that.
I want to wrap up the interview this way, Lorian.
Sure.
The, I mean, obviously, having a government that's competent and can work,
Yep.
pull the levers of the levers of government in a competent manner would fix some of these problems.
Yep.
Uh, are there any legal or legislative changes that could be made by a government that would, prevent some of this from happening? Set standards, for example, in legislation, that kind of thing.
So certainly there are legal tools that would be available to government to try to address these issues. They could put some basic standards in, for example, the Health Insurance Act. They could also create more provisions in the health insurance or health facilities legislation around monitoring, overseeing these private surgical facilities, ensuring that costs and access are addressed. The contracts that government will have with these private surgical facilities also are an opportunity to use the law to bind them around what they're being paid, how they're being monitored, what sorts of patients they're seeing, whether or not they're pushing costs back onto the public system. All of those are things that can be addressed contractually. And then also, there are obvious changes that I think could be made to legislation that would improve access, improve equity. So, for example, we're now in a situation where nurse practitioners are able to operate independently and bill the government, but some of the same protections that exist for physicians to not double bill patients by billing them and billing the government, or not charging fees that exceed what they would be paid under the public system. Those kind of protections that arose under the Canada Health Act in the context of physicians haven't been extended to nurse practitioners. And then there's also the issue of just enforcement. And so there have been countless examples over the past few years of the government not enforcing some of its provisions around people who are violating, health professionals who are violating provincial law and are charging patients for insured services. And so just enforcement also of existing laws could be a valuable activity for the government.
Well, it sounds like there's a lot that could be done. Now, whether
Yeah.
it will be done is an open question, based on the track record, probably not. Lorian, thank you very much. Really appreciate this.
Thank you for having me.